If you're watching this, you probably own or run a treatment center and you're asking yourself a big question. Should we go in network? A lot of centers start out in network because it feels easier. Cash pay clients and high reimbursements look good on paper. But here's the truth. If you try to stay out of network forever, you will always be riding the roller coaster. You'll be up one month, down the next, relying on massive marketing budgets, and worst of all, you'll be turning away more people than you can actually help. That's not sustainable. At Behavioral Health Partners, we believe in building centers that not only grow financially, but also serve their communities for years into the future. In this video, I'm going to show you why going in network is the most strategic decision you can make if you want your center to thrive long term. Hey, if at any point during this video you decide you want to stop doing this stuff yourself and see what it looks like to work with Behavioral Health Partners, book a call with us right in the description below. So let's start with the reality of out of network. On the surface, the appeal makes sense. You can charge higher rates, you have fewer hoops to jump through at first, and you think you'll get a healthier bottom line. But what actually happens is this. You're constantly chasing admits, pouring money into marketing channels, and rejecting the majority of callers because they don't have the right insurance or the cash to cover treatment. That leads to inconsistent census, burned out admissions teams, and a revolving door of marketing strategies that never quite stabilize. I've seen too many centers fall into this trap. Truth is, out-of-network facilities have a much higher rate of failure in this space. Even the ones who figure out their admissions channels often struggle to hold steady without spending huge amounts to keep beds full. Now let's look at the other side. When you go in network strategically, not just signing any contract, but choosing the right payers with rates that make sense and cover a large portion of your local population, everything changes. Suddenly, your census becomes sustainable. You're not rejecting the majority of callers. You're not dependent on whether your cash pay ads hit that month. You're building a brand that your local community can actually access. Families feel relief when they hear the words, "Yes, your insurance covers this." That's a powerful trust builder, and it positions your center as a real solution, not just another treatment option that's out of reach. Going in network allows you to grow steadily, develop referral relationships, and become a recognized name in your region. That's how you build something that lasts. Now let's talk profit margins, because this is where most owners hesitate. Yes, on paper, out-of-network reimbursements can look higher. And yes, some centers that really crack the code on their admissions channels can get to a point of 30% or higher profit margins. But those are the exception, not the rule. The reality is that most out-of-network centers are on shaky ground. They live and die by their monthly marketing spend, and they're constantly scrambling. In-network facilities, on the other hand, average 22 to 28% profit margins, and while that may sound lower, it's actually a much more sustainable business model. It gives you predictable revenue, stronger relationships with payers, and most importantly, the ability to help far more people who call you. If you put those two side by side, I'll take the in-network model all day long. Because this isn't just about today's margin. It's about building a business that lasts, grows, and continues helping people year after year. There are a few myths I want to clear up because I hear them all the time. Myth number 1, reimbursements are always terrible. That's just simply not true. With the right strategy and negotiation, you can secure contracts that make sense for your business. Myth number 2, going in network takes forever. Timelines do vary, but with proper preparation and guidance, you can often move faster than you think. Myth number 3, you lose control. In reality, you still run your program. You're still setting your clinical model, hiring your team, and delivering care. The difference is that now you've got payer backing that makes your services accessible to a much larger group of clients. Now let's talk about the biggest mistake centers make when they finally decide to go in network. Too many owners just accept the first contracts that land on their desk. They don't negotiate, they don't run the numbers, they don't ask, what is the bottom line we need for this contract to make sense? Going in network doesn't mean saying yes to every offer. It means being strategic. You need to know your cost per client, your staffing ratios, your facility overhead, and then negotiate contracts that support those realities. If you don't, you could lock yourself into bad agreements that hurt your center instead of helping it. To go in network successfully, you need more than just payer applications. You need a solid foundation. That means accreditation, TJC or CARF. It means compliance and policies that meet insurance requirements. It means strong EMR systems and data tracking to prove your outcomes. This is where many centers stall out. They either don't have the resources or they don't know how to put all the pieces together. That's exactly where Behavioral Health Partners comes in. We've helped centers across the country navigate the licensing, accreditation, compliance, and payer contract process. And we don't just focus on one step. We make sure the entire system is aligned for long-term success. Here's what makes us different. We believe in access to treatment. We don't just help centers chase cash or quick wins. We help build treatment programs that are sustainable, profitable, and truly serve their communities. We know how to balance clinical quality, financial viability, and strategic growth. When you work with us, you're not just getting guidance on one piece. You're getting a partner who understands the whole puzzle and will walk you through it step by step. At the end of the day, out-of-network may look attractive on the surface, but it's not a long-term solution. It keeps your census unstable, forces you to spend enormous marketing dollars, and makes you turn away most of the people who reach out for help. Going in-network, on the other hand, gives you access to the majority of families in your community, creates predictable revenue, and builds a foundation for growth that lasts. So here's my challenge. If you're ready to stop riding the roller coaster of out-of-network and start building a sustainable in-network treatment center, schedule a call with me and my team at Behavioral Health Partners. The link's in the description below, and we'll walk you through the process, help you avoid the common mistakes, and set you up with the contracts and systems you need to grow. Because this isn't just about building a business. It's about making sure your doors stay open and your beds stay full so you can help as many people as possible in the years to come. I look forward to talking with you soon. For Behavioral Health Partners, your trusted partner in growth and impact.